Hi, welcome to Children's.
The foremost thing that we have thought about throughout this whole pandemic has been, how do we keep our patients safe? How do we keep our staff safe?
Have you or a family member experienced any fever?
Dr. Ryan Redmond has been balancing safety with health.
Finding that middle point and allowing for a safe but still comforting place is what we think about all day.
The medical director of the emergency department at East Tennessee Children's Hospital knows children and their parents need a welcoming place to come when they're in serious need during a trip to the ER. Even with COVID-19, that hasn't changed.
Of our masks that we wear at all times throughout the building, in addition to our eye protection, that'll of course look different, and that's something that probably is a good thing to prep patients who are coming, especially the younger ones, that this is what you're going to see, and it's to keep everybody safe.
The virus has left the waiting room mostly empty. People just aren't coming in.
It certainly has made it to where that with social distancing and kids not being in school and other infectious diseases going down because of the precautions that we're taking for COVID, that it has been pretty quiet around here lately. But that's something that's we would rather have that than be overrun.
It looks nothing like what you might see on the news, with tons of people in masks combating chaos.
The images that you're seeing from overcrowded emergency departments, from people who are kind of running around and way overburdened, is just simply not what we're seeing here in Knoxville right now.
Redmond says, don't be afraid to head to the ER if your child has trouble breathing, hydration problems, cuts or broken bones, or just anything that you deem serious. As of April the 9th, Children's Hospital hasn't had any positive COVID-19 cases.
Yes, the important thing to know, again, that this pandemic and all of the things that are associated with it and staying at home and being out of school is going to cause a lot of stress and anxiety amongst all families. I think we all feel that. The important thing I think that parents need to know is that to keep talking about the positive aspects of this, the fact that kids are going to be safe. They're going to be healthy with this.
And there's reason to be optimistic.
We certainly had a later start to all of the cases here than they had in some of the harder hit areas. Our population density is also a lot less than the big cities. So I think there's good reasons to be optimistic. As long as people are sticking to the social distancing, I think the early data is that we have started to flatten this curve.
And always remember, the Children's Hospital ER and urgent care are great options for care.